Now I'd like to call upon Dr. MalathiVoora, who's our dietitian. She's worked with many of our kids with SMA and also the adults with SMA.
So I am going to add a word here. Thank you so much, Dr. Malathi, for being here. She's just recovering from surgery and has still come. She's had some bone fracture and things. But Dr. Malathi, a special word, has helped many of our children with SMA with regards to nutrition. Even when we give this really expensive drugs like gene therapy, there are patients who have succumbed. Parents often don't understand that if you're very, very thin and malnourished, many of your children get one viral infection that will kill them. So we've had children who were like 4 kgs at 2 years and things like that, whom she has managed to pull out. Then when they become older, becoming overweight is also a problem. But she somehow knows how to strike a balance. So thank you, Dr. Malathi.
Thank you, Dr. Ann, all expert team and parents and family, all family members and everyone for giving me this opportunity to speak about SMA, nutrition in SMA today. Outline of my talk would be about, I will talk about causes of poor nutrition in children with SMA, how to address nutrition in children with SMA, different feeding routes or techniques that are used, challenges in nutritional rehabilitation in SMA, nutritional goals in adults with SMA, and about 2 cases also I will be discussing. As you could see in this picture, there is a good food express. So what is it carrying? It is carrying different nutrients, macronutrients, which means they are required in more quantity, and micronutrient they are required in small quantity. Yet both are very important to provide energy and perform body functions. So in particularly regarding SMA, the nutrients that are required are macro, that is carbohydrate, protein and fat, and the micro ones, vitamins and minerals, vitamin C, vitamin D, vitamin B12, calcium, magnesium, iron and zinc. These are very important. So how can we get all these things? Only when they are given a balanced diet. So right diet is important. When we talk about carbohydrates, they should remember that, all cereals that we normally take like ragi, bajra, millet, wheat and all contain carbohydrate, and the proteins, which are the body building sources, they are supposed to be body building foods because they help in the growth of the cells. These are present in the vegetarian sources as well as non-vegetarian sources. So vegetarian sources are pulses, legumes, nuts and oil seeds, whereas non-vegetarian sources are eggs, meat and poultry. So through these things we can get proteins and build the body. That means they help in the growth of the cells of the body, which can perform better. Coming to the causes of poor nutrition in SMA. What are the causes? Poor muscle mass. Because of that leads to low body weight. Poor weight gain could be due to swallowing difficulties. Because of swallowing difficulties, their oral intake is very poor. They would also have reflux issues. Then breathing issues, which because of breathing issues, it leads to high metabolic rate. Because of high metabolic rate, the increased demands are seen, increased energy demands are seen. So on one side, energy intake is very poor due to swallowing issues or maybe reflux or maybe poor muscle mass. And on the other side, the need is more, the demand is more because of the breathing issue. So there will be definitely an imbalance in the calorie intake. So the intake is very poor, whereas the need is high, the demand is high because of the high metabolic rate. So thereby leading to imbalance in dietary intake, especially the overall calorie intake. And the other reasons could be due to delayed weaning. So with our experience, what we have noticed is in these children, there is prolonged formula feeding, infant feeding practices. When we observe that, when it was noted that they're taking the formula for a very long period, they have not started complementary feeding on time, or they would have just started one or two things which they think it is comfortable to child. They're more scared about the other issues, because of which they are just sticking on to just one or two things like milk-based diet or water and formula-based diet, thereby leading to imbalanced intake of calories, and also due to lack of nutritional awareness and faulty feeding techniques. All these are contributing to poor nutrition in SMA. How to address these nutritional issues in SMA? The first and foremost thing is calorie intensification. So that's the thumb rule for providing good nutrition to SMA children. How do we intensify the calories? So we would sit with a parent and understand their home diet and their practices, and based on understand the current practices that are followed, then calculate the nutrient intake of the diet as per the diet recall. Most of the time it will be like 40% or 50% deficit of calories. Then we would intensify it with more challenges wherein there will be a restricted volume also. So within that we need to make it more dense, but which means per ml of liquid, per ml of fluid, we need to make it as 1.5 kilocalories per ml, rather than making it as 1 kilocalorie per ml. That is not a calorie dense thing. So we need to increase it to, we just slowly, we gradually we have to increase it by 1.2, 1.5 per ml, kilocalories per ml, then to 2 kilocal per ml, like that, based on the complaints that has to be increased. So that is simply called as calorie intensification. The personalized diet chart, how does it help? Because all children are not same. All of them would not have the same demand or same requirement. Their practices are different. So how to make it more sustainable? We generally sit with them, and during periodic follow-ups, make a personalized diet charts or a feed plan to them. Modify their feeding techniques appropriate and safe for each SMA child. For example, the child is on NG feeding, and the volume that is allowed is only 60 ml second hourly, maybe up to 10 feeds in a day. Sometimes the parents are not able to follow that. If they are giving more than that, that is not safe, or otherwise there are more interruptions wherein they're not aware that child can be fed even when she is sleeping. So that time when the child is sleeping, they are not giving, then there is another interruption. The volume which is already less, which is prescribed, is not given according to the prescribed volume. So that is also that can also meet the calories that are recommended. Then there will be definitely deficit even with the revised diet plan. So modifications normally we do based on the safe practices and how safe it is to the child. Based on that, like how many hours of BiPAP they are on, how many, like what is the time that they go to physiotherapy, they attend the physio sessions. Lot many things are involved in modifying the feeding techniques of the child. So that is a reason why regular follow-up with specialized dietitian is important to understand the requirement and change it time to time. Regular weight monitoring is always emphasized during their visits, because without this we will not be able to understand whether the targets can be met in near future or not. So the weight has to be checked. In some kids, we would tell them to check it every second day or every third day, which means 2 to 3 times in a week. Or maybe in some children, we would tell them to check it every week. So week on week weight check plays a very important role. Parents, please understand that this is important, and please start checking the weight. And then with the help of this monitoring, the chart only, we will be able to help you all better. Address other nutritional deficiency. As I said, micronutrients are also important, because that would add on other problems in these children when we are going to treat with address the issues. So iron deficiency and vitamin B12 deficiency also to be addressed by adding on iron-rich sources and the foods that help in better absorption of iron, like vitamin C and all, that has to be taken, because it's not only the thing which is containing more iron, there are also some facts like nutrient interactions and better absorption, bioavailability. All these things will be considered. So calorie intensification is a challenge because most of them would be on a low volume feed. So low volume feed and high energy. So and again we should not go aggressively also. It should be always be done in a gradual manner. So some of the foods examples are like it can be done. It is not the same for everyone. Again based on the personalized chart, whether the child is on oral feed plan or an NG2 feed plan or PEG feed plan, we would modify it. For example, thin fruit milkshake. Generally, fruit milkshake, usually in fruit milkshake, milk and fruit is added. We would also advise a parent to make it more calorie dense by adding some fat sources, ghee or MCT oil, and some carb sources like sugar or jaggery, and also some seasonal foods like coconut milk or coconut flour or almond powder based on the availability and the convenience they need to add on and make it more having said that, it should be done with dietitian advice, otherwise there will be more problems with the hyper osmolar feeds again. So osmolarity would change. So everything based upon the ratio that is given by the dietitian only they need to follow. Similarly, say instead of giving a normal clear vegetable soup that doesn't give much calories, not more than 30 to 40 kilocalories, it is better to add on some dal and some potato or some cornstarch or some nuts powder and some oil that can make it more calorie dense. These are few simple examples of calorie dense foods. Coming to feeding techniques, some of them are on oral feeding, some of them are on combination feeding, some of them are on NG2 feeding, some of them are on PEG tube feeding. Some of them are on continuous feeds also. So continuous feeds we recommend when there is a situation wherein the weight gain is very difficult, very slow, and the volume is also very low, that is permitted, the fluid volume, and it is taking a long time, and then we suggest them to add on continuous feeds by using the infusion pump. So usually we recommend them to take it, do it in the night time, so that it is convenient to parent. So at a stretch like 3 to 4 hours at a stretch with hourly 30 ml or 40 ml per hour. It will go on for 3 hours or 4 hours with a gap of 1 hour again. So that will give extra calories to the child. So within the small, sometimes the volume is not taken up. The complaints issues would be there if it is only the bolus feeding. So in that situation, we would recommend continuous feeds also. So when this is about tube feeding, how to deal with calorie intensification in a tube feed child. Normally, we would do 40 to 60, 40 plus 60%, which means 40% would be from the regular home-based cereal and pulse-based kitchen blend, and the 60% would come from the formula feeding. So without which it is difficult to achieve targets. Formula is important for some time. That formula can be, again we decide on the formula, whether it will be a polymeric formula or a partially hydrolyzed formula or extensively hydrolyzed formula based on the gut condition of the child. So based on that, 60% calories would come from the formula and the 40% from this. But in some children, maybe 100% should come from formula when the gut is not stable. It is not, when they are having regular issues and the loss of weight is seen. So challenges in nutritional rehabilitation in SMA, lack of regular follow-up is the important challenge. So due to something like due to some hospitalization in between, or due to the fact that the child is growing, then it's okay, even the child's weight is growing, it is better to have regular follow-up to understand that how far you are to reach the target. We would have set the targets of the weight gain, right? So to reach the targets, we would want to know, sit as a team and understand like how much duration it will take to reach the target. Or sometimes there is a loss due to some recurrent infection, weight loss, severe infection like bronchopneumonia or things like that. Then there is a loss. They would have gained with the diet plan and the advice adherence to the diet plan. It has helped in gaining the weight, but suddenly there is a dip in the weight. So we need to understand, then parents should always be in continuous follow-up with a dietitian, which can help combat the further malnutrition. And even in chronic malnutrition, very slow, sustained nutritional rehabilitation is required. Otherwise, refeeding issue can happen. So in chronic malnutrition, we will go slow in increasing the calories by like 30 to 40 calories, and then increase it further by 60, then double it by 1. And even when there is a transition from NG2 feeding to FEG feeding, after gastrostomy also, we would increase the fluid volume and calories by 20% for every 10 days. Like that, we would follow the regular norm and then understand it and do it slowly. Also, we generally address constipation and hard stool issues by changing the formula, or by reducing the milk intake, or by adding some fiber rich sources or some medicines to relieve this problem. So regular follow-ups would involve the growth chart assessment, the plotting the growth chart, periodic weight check, plot the end symptom tracker, complaints and challenges, modify the diet plan to attain the targets. Coming to adults, we talked about children with SMA. Now for adults with SMA, what to do? For them, it is always important to maintain normal BMI for regular weight monitoring, because otherwise it would lead to obesity and things like that. So to prevent obesity, ensure balanced diet, avoid high calorie foods, diet to be aimed at preventing comorbidities. But if they are already having comorbidities, then we have to plan accordingly, like a diabetic plan or a weight reducing diet plan, like that. Case discussion. In this case, these baby parents are very much aware, they are well educated, they have tried many things, and then before the child was not able to put on weight, and we understood that there is problem with the gut because of chronic malnutrition. So we tried with partially hydrolyzed formula, avoiding all the regular kitchen things, but still the weight was not increasing as expected. Then we, again in an expected manner, it was not increasing. Then we changed the partially hydrolyzed formula to extensively hydrolyzed formula and put her on a very long time, maybe up to 4 to 5 months the child was on only on extensively hydrolyzed formula. That has helped in solving this issue. Child has put on weight, and we could see the difference before and after nutritional rehabilitation. So like this, personalized diet plans are always important. So in another case, we have taken the weight details with the help of the weight monitoring chart that they have during the subsequent follow-ups. We have given a combination of partially hydrolyzed formula and some of the things which we have designed at clinic, the calorie dense formula, the home-based ones only. So both are combined, and this child is doing well. We could see the targets achieved. Thank you.
Thank you so much, ma'am. That was very informative. Now I request Mrs. Divya Bharati, one of the mothers of a child with SMA, who is our patient, to present this memento.
Our next speaker is Dr. Ramya S. Dr. Ramya S., who is our pediatric intensive care specialist. So, thank you, Dr. Malathi. I think our other Dr. Ramya has an announcement. So, the pediatric intensive care is the backbone for many of this. So, many of you parents who are here are very motivated people, but still your children, when they fall sick, it's not the same as when other people fall sick. Often you think it's just a cold. Just sardi zukam, that's all you think. But no, it's not. Their sardi zukam, their cold goes on for 2-3 weeks, and then you land up in trouble. So that can be prevented, avoided. Often if you come in, they can give some expert advice and avoid many of these things. So on to